Ever heard of bronchiolitis obliterans organizing pneumonia? No? Well, you're about to. It's not as common as the flu or as talked about as asthma, but it's just as important to understand. This mouthful of medical terminology, often shortened to BOOP, is a clinico-pathologic syndrome. This means it's characterized both by the symptoms a person experiences and the microscopic changes that occur in the body. In the case of BOOP, these changes involve respiratory illness and the formation of granulation tissue, a type of tissue that forms during the healing process in specific parts of the lungs, namely the bronchiolar lumen, alveolar ducts, and some alveoli. And while it might seem like something that only affects a certain group, BOOP can actually occur in people of all ages. So, BOOP is not just a set of random letters, it's a serious lung condition. How do you know if you have BOOP? Pay attention to these symptoms. Bronchiolitis. Obliterans organizing pneumonia, or BOOP, can present a range of symptoms. The most common ones are a dry cough and shortness of breath. Picture it as if you're trying to breathe through a straw. It's difficult and uncomfortable, isn't it? That's what it feels like for someone with BOOP. Now, it's important to note that not all cases are the same. Some people might experience milder symptoms, which can make it harder to identify. On the flip side, there are rare instances where symptoms are more severe. In these cases, individuals may experience hemoptysis. That's a fancy term for coughing up blood, and acute respiratory distress. This is when the body isn't getting enough oxygen, and it can be quite serious. But don't let this alarm you. Remember, the key symptoms to look out for are a persistent dry cough and shortness of breath. If you or someone you know is experiencing these symptoms, it would be a good idea to consult with a healthcare professional. Remember, persistent cough and shortness of breath are key signs you might be dealing with BOOP. BOOP might be hard to spot, but there are ways to confirm its presence. This tricky lung condition can often play hide-and-seek with medical professionals, mainly because its imaging can closely resemble other lung conditions. Chronic eosinophilic pneumonia and interstitial pneumonitis are two such conditions that can be easily mistaken for BOOP on imaging. This overlap can make it quite challenging to pinpoint BOOP accurately based solely on imaging. However, as is often the case in the medical world, one door closing doesn't mean all doors are closed. When imaging proves to be a little less than helpful, tissue biopsy steps up to the plate. A tissue biopsy involves taking a small sample of lung tissue, which is then studied under a microscope. This microscopic examination allows pathologists to identify the presence of granulation tissue, a type of tissue that forms during wound healing in the bronchiolar lumen, alveolar ducts, and some alveoli. These are characteristic features of BOOP, and their identification can provide a definitive diagnosis. It's important to note that a tissue biopsy is an invasive procedure, but it's one that provides a high level of diagnostic certainty. It's like having a pair of glasses that allows us to see what's really going on in the lung tissue, cutting through the uncertainty and providing the much-needed answers. In the world of medicine, diagnosis is often half the battle won. And while diagnosing BOOP may pose a challenge, the tools and techniques at our disposal, like tissue biopsy, can help us get there. So don't let the complexity deter you or cause undue worry. It's a puzzle, yes, but one that can be solved. Remember, when it comes to BOOP, it's not about finding the easiest path. It's about finding the right one. Diagnosing BOOP is a challenge, but a tissue biopsy can provide the answers. Now that we've identified BOOP, how do we treat it? The answer lies in the use of steroids. Steroids are powerful anti-inflammatory drugs that can help to reduce the inflammation and scarring in the bronchioles that characterizes BOOP. The primary steroid used in the treatment of BOOP is prednisone. This medicine works by calming the immune system and decreasing the body's natural immune response, which reduces the inflammation in the lungs. Patients typically respond favorably to prednisone, experiencing significant relief from symptoms such as dry cough and shortness of breath. Treatment plans are often tailored to the individual's needs and may vary in dosage and duration. The response to prednisone is usually monitored through regular follow-ups and imaging studies to ensure the inflammation is being controlled effectively. However, it's important to note that BOOP can recur. This can be disheartening to hear, but the silver lining is that recurrence can usually be treated effectively with the same dosage of prednisone that was previously effective. This means that even if BOOP does return, there's a good chance that you can get it under control again with the right treatment. Of course, each case is unique, and what works well for one person may not work as well for another. Regular communication with your healthcare provider is key to managing this condition effectively. In rare cases, BOOP may not respond to steroids. This is known as non-responsive BOOP, and it may be associated with other underlying conditions or a combination of BOOP and other forms of pneumonia. In these cases, additional treatments may be necessary. Despite its potential to recur, the prognosis for most patients with BOOP is generally good. With the right treatment, most people can lead normal, healthy lives. While recurring, BOOP can be controlled effectively with the right dosage of steroids. Let's recap what we've learned about BOOP. Bronchiolitis. Obliterans organizing pneumonia, or BOOP for short, is a syndrome that can affect people of all ages, causing respiratory illness. Its symptoms, including dry cough and shortness of breath, might seem benign, but can escalate. Diagnosing BOOP isn't as straightforward as it might seem. Its imaging can resemble other lung conditions, making a tissue biopsy necessary for a definitive diagnosis. When it comes to treatment, the use of steroids is the primary method. Patients generally respond favorably, and the treatment can be repeated if the condition recurs. However, non-responsive BOOP may indicate other underlying pathologies or a combination of BOOP and other conditions like UIP-IPF. BOOP is more than just an unusual acronym. It's a serious lung condition that demands attention and understanding. It's essential to be aware of its symptoms, diagnosis methods, and treatment options. For further reading, consider looking at these references. Bronchiolitis obliterans organizing pneumonia, BOOP, a unique pathologic entity that may be associated with lower respiratory tract infection, connective tissue disease, and adverse reaction to drugs, from the Chest Journal. BOOP, an important cause of migratory pulmonary infiltrate, from the European Respiratory Journal, and bronchiolitis obliterans organizing pneumonia, pathogenesis, clinical features, imaging and therapy, from PubMed.